Hi everybody, Ashley Oswald, dietitian with Oswald Digestive Clinic back, and I'm so excited today to be talking about this new good quality study that came out of Spain of how vitamin D could help an individual admitted to the hospital with COVID-19. We made a video, it must have been a few weeks, maybe even a few months ago, about vitamin D and some of the other research around this COVID-19 and vitamin D and some observational research and studies, and I'll link that here so you can go watch that. We won't be a broken record and repeat it. Check it out though, but this one's even more significant. It was published just a week and a half ago. I wish I would have jumped on it a little sooner and made this video for you, but here we are. And this was done in Spain, and basically the Spanish patients and the doctors, they realized the importance of vitamin D. They wanted to do a study to test and see just how effective it could be in helping these individuals. I mean, we're all healthcare providers because we want to help, right? And I should say that first and foremost because there's some shaming going on around this stuff, and oh, nutrition can't help in this case. But how do we know it can't help? You know, we haven't fully researched it. So I'd say just come in with an open mind. And we know vitamin D is very important for the endocrine system, and they especially knew it was helpful in decreasing something called ARDS, acute respiratory distress syndrome. So basically, this is the best design study you can do. It is randomized, double-blinded clinical trial at a university hospital in Spain where there were 76 patients hospitalized with COVID-19, and they gave some of them vitamin D, some of them not, and here's what happened. I'm showing just the research study on the page because there's been some censorship around things like this, and I just want to, you know, just show you the facts. There's no question. I'm just reading right from this paper. This is on PubMed. You can go easily search it yourself. And so of the 50 patients treated, with vitamin D, 1 required admission to the ICU, while the 26 untreated patients, 13 required admission. So that is significant. And if you don't know, I've worked in a hospital for many years. The process of admission, if someone's coming in really severe trauma, of course they go right to the ICU. But if somebody comes in and they don't need that intensive ICU cares, like something like a virus where they're not to that point where they're really struggling to breathe, they can just be on the floor and they can get proper care just on the floors. But once they surpass a certain severity of their illness, they're going to get transferred for the ICU where just the staff are more trained in treating those things and the equipment is better prepared to help them. Of course, you hear a lot about intubation. The ICU is where patients get intubated, not just on the floor. So going from a floor, you know, just general medicine unit to like the MICU, the medicine intensive care unit, that it just means that a person's disease progression has gotten worse. So the fact that 13 of the people who did not get vitamin D, while only 1 of the people who did get vitamin D were admitted to the ICU, I mean, that's pretty significant when there is only 50 patients altogether. And so of the patients treated with vitamin D, none died, all were discharged without complications. The 13 patients not treated who were admitted to the ICU were discharged. Of the 13 patients admitted to the ICU, 2 died and the remaining 11 were discharged. So in conclusion, we can read it right here. Our pilot study demonstrated that giving high-dose vitamin D or 25-hydroxy vitamin D, calcifediol, that is just another word for vitamin D, a main metabolite of the vitamin D endocrine system, so significantly reduce the need for ICU treatment of patients requiring hospitalization due to proven COVID-19. So proven, they did the lab test. Calcifediol seems to be able to reduce severity of the disease, but larger trials with groups properly matched will be required to show a definite answer. That's what a lot of research says, especially in nutrition. Need more research, but this study, for a nutrition study, I mean, this is really kind of exciting and significant, and as a dietitian, it's very low risk to supplement with vitamin D. We know it has great benefits. So even if you're don't have COVID-19 at this point, I would really recommend you to get a lab test and make sure that your vitamin D is optimized, because if we're showing benefit here, there's likely benefit even before, and maybe even for prevention of, having issues if you do come across this virus and really any other virus. It's just a great vitamin. Is actually a hormone that supports the immune system. So there you have it. I hope this was helpful. Again, this is brand new, hot off the press, August 29th, 2020, and I hope you found it helpful, and I hope you have a great rest of the day, and I will see you on the next video. Bye.